You're listening to Puma Podcast.
Hi, I'm Bella Perez Rubio, Puma Podcast, and you're listening to Teka Teka News. In this episode,
we are very much aware that in Asia, this is still the leading cause of cancer in the reproductive tract and the leading cause of death in women worldwide. In the Philippines, it is the second leading cause of female cancer and the third leading cause of female cancer death.
in May, the Philippines marked Cervical Cancer Awareness Month for the 20th time. The disease continues to claim thousands of Filipino lives each year. But there's a way to eradicate the disease altogether, and experts say we should be doing more to get it done.
I am Efren Domingo. I am presently the president of the Philippine Obstetrical and Gynecological Society.
Dr. Domingo was speaking at a forum hosted by the Strat-based Albert Del Rosario Institute.
In the Philippine General Hospital where I worked, we met the youngest case. She was a 13-year-old with stage 3 cervix cancer, and she came to us in uremia. And she became a commercial sex worker at the age of 6.
That's right. Girls as young as 13 are contracting cervical cancer. It's the second leading cause of death for women in this country. It's also a cancer that disproportionately kills women in low and middle income countries. The World Health Organization estimates that 342,000 women died of cervical cancer in 2020. Of these, the WHO says 90% lived in low and middle income countries. Each year, some 8,000 Filipinas are diagnosed, and a little over half that number die. The Department of Health said around 12 women in the Philippines die of cervical cancer each day. But it's not all doom and gloom. There's a vaccine for HPV, the virus transmitted through sexual contact that causes cervical cancer. And there's a clear path towards eliminating the disease worldwide.
The World Health Organization, the vision is to have a world without cervical cancer. And because of this, they initiated studies from 2020 that determined the incidences in 185 countries. And the target is to achieve a threshold of 4 out of 100,000 women in many parts of Asia and Latin America. This is a very challenging target, the 90-70-90 profile that we have to achieve in screening, vaccination, and treatment.
Here's a breakdown of that 90-70-90 target. HPV vaccination of 90% of girls before the age of 15, high-performance testing of 70% of women by the age of 35, and again by the age of 45, and treatment of 90% of women with pre-cancer and management of 90% of women with invasive cancer. Each country needs to meet this target by 2030 for us to stay on track to eliminate cervical cancer in the next century.
While we present this repeatedly, we are, of course, saddled by multiple factors, as well as collaborative challenges, as we spoke about it a while ago. And so the global eradication is aimed at achieving this over a period of almost 100 years, where hopefully by that time, the incidences will improve and the deaths will be lowered.
The WHO warns that we could see 400,000 deaths in 2030 if we fail to meet the 90-70-90 target. But if we do meet the 90-70-90 target, the WHO says 2 million lives can be saved by 2040 and 5 million can be spared by 2050. So what are we doing to meet this goal?
We have to deal with all the sectors in order to achieve our goal, and this includes government. The Philippine Cancer Control Program is a strategy to deal with the primary, secondary, and tertiary level of care in order to control this dreaded disease. At the pre-malignant aspect, it should be ideally diagnosed and treated in order for us to avoid having this disease affect the elderly 40 to 60-year-old age range. So these are the 6 pillars. We have met this for several years already, from epidemiology, education, cancer prevention and early detection, treatment and training, tumor registries, and of course, pain and palliative care. It's a very comprehensive inclusion of all the concerns of an oncologist, but it actually begins right there in the primary care and public health concerns of clinicians.
We talk about the roadblocks the Philippine Cancer Control Program faces after a quick break. While the plan sounds comprehensive, there are hiccups and shortcomings on the ground. Just take the first step of screening.
2005, we started the cervical cancer screening program. This was an initiative of our Department of Health with a target of having a BIA screening of at least once every 5 to 7 years. So the challenge indeed is to increase the frequency of women being seen in the gynecologic care of a clinician. If only that can be achieved, then it might really create a dent in the stage distribution of this cancer.
A visual inspection with a CTIC, or VIA, is a cost-effective way to test for cervical cancer, which is available in local health centers. Another screening tool is a pap smear, which checks cells in the cervix for abnormalities.
So the utility of the cervical cancer screening program, unfortunately, is low still in this country. And there is a need to increase budget as well as to convince government to put in more personnel as well as instrumentations necessary to achieve the goal. The proportion of women undergoing pap smear, those who had screening or have heard about screening is really very low. And the proportion of urban and rural patients undergoing the care of a clinician or education is still lacking.
Here's what's keeping women from getting tested.
So the utilization of cervical cancer screening becomes a challenge because of these 6 concerns. Our women are afraid. They are financially handicapped. They are not well educated. They fear about the disease. And they are not ready for out-of-pocket service and vaccination or screening.
This is a major roadblock. If you remember WHO's roadmap, by 2030, we should be testing 70% of Filipinas by the age of 35 and again by the age of 45.
The objectives, apart from awareness, education, will be to screen and detect the lesions, and treat it right there, hoping that the woman is good when she leaves the clinic, and then a very good referral system. And treatment protocols that are encouraged to be well aware in the scope of the generalists as well as the specialists. So as we speak, the objectives are indeed very challenging because it will involve a lot of the sectors in our community.
And then there's the vaccine.
The WHO 2020 analysis of 185 countries showed that in the case of Asia, as well as in Latin America, the age incidence is becoming uncontrolled and they may peak at a later age, whereas in first world countries, they peak at a 30 to 40-year-old age range. It's because of the good screening and appropriate treatment of pre-malignant lesions. The analysis is driven by a very good screening and HPV vaccination in the low as well as in low middle income countries. It is important to introduce vaccination early, and the target should really be to include it in the community as well as in the school venues.
But how do we achieve this?
So public health profiling of this specific area should be in detail and available to the clinicians so that they will be able to target the specific locality with high incidences. It should actually be the most important concern this morning. We cannot do it alone as oncologists. We have to collaborate with government, with the public health sector, the community experts, as well as the pain and rehabilitation specialists.
In short, eradicating this disease comes down to a whole of society approach.
I like to speak also that the level of human development, the HDI, the index of care, as well as the availability of resources, is the complete image of the difficulty that we have to hurdle in order for us to achieve the control of cervical cancer. It has been realized in the study of the WHO that if the HDI is high, the level of control of this disease will improve. And if we can only include the funding from all available government and non-government agencies, this becomes easily achievable.
For this doctor, the cause could not be closer to home.
I actually lost my very own mother from cervical cancer. I recall bringing her to, it was still called North General Hospital for radiation, and at Medical Center Manila for radiation. She survived stage 3 cancer and lived 32 years, only for me to become a gynecologic oncologist. I eventually discovered as an oncologist a cancer, again, from the cervix, from the same virus when I was already a consultant. We initiated our best treatment for her, but because of many other factors, when it recurred 32 years later at age 81, she was 49 when she had it, when I was in grade 6. We were not anymore successful. But we thank our good Lord that she was able to earn for me to become a doctor and a gynecologic oncologist. I speak to you as a student, as a consultant, and as a son of a mother who was diagnosed and died from cervical cancer. We will lose more women if we delay. Children will be uncared for because their mothers die.
And that was today's episode of Teka Teka News. Again, I'm Bella Perez Rubio. This episode was edited by Pedoy Blanco. Get in touch with your physician or your local clinic to see if you should be getting vaccinated or screened for cervical cancer. And follow Teka Teka News on your favorite podcast app or listen to us for free on YouTube. Thanks for listening.